Thank you. I never get a picture. Later, maybe I'll take. Thanks.
Hello, can you hear me, Chandraban? Yeah, can you hear me now, Chandraban? You can hear? Okay, so Chandraban,
Good morning. This is to announce that our chief guest for today's program will be arriving shortly, and I would like to request all of our friends outside in the corridors to please take your seats and await the start of the program. Thank you. वाले side.
Okay, the program list, I want to see whether they have shared the correct one to you.
Ladies and gentlemen, may I request one and all to kindly rise and welcome the chief guest of today's program, the Honorable Chief Minister of Meghalaya, Shri Conrad K. Sangma, accompanied by the guest of honor, Dr. M. Ampareen Lingdo, the Honorable Minister, Health and Family Welfare Department, the respected Chief Secretary, Shri Donald Phillips Walang, the Principal Secretary, Health and Family Welfare Department, Shri Sampat Kumar, Dr. Joram Beda, the Commissioner and Secretary, Health and Family Welfare Department, and other dignitaries.
Kaushik Sharma also please announce. Kaushik.
You may be seated. In the custom of our state and our people here, let us now felicitate the dignitaries on the dais as a gesture of welcome. May I request the ushers to kindly approach the dais and do the honors. We extend a hearty welcome to the Honorable Chief Minister Meghalaya, Shri Conrad K. Sangma, with our traditional Rindia stole and a hamper of gifts. Can we support with a round of applause, please? We also extend the gesture of welcome to our Honorable Minister, Health and Family Welfare Department, Dr. M. Ampareen Lingdo. We welcome you, ma'am. We also have in our midst the respected Chief Secretary, Meghalaya, Shri D.P. Walang. And we extend this gesture of welcome to you too, sir. We are also indeed privileged to have with us Padma Shri Dr. Sudarshan Hanumappa, the founder of Karuna Trust. May I request the ushers to kindly approach the dais and to welcome Dr. Hanumappa in our midst. I would also like to call upon the ushers to kindly approach the dais and welcome Shri Nachiket Moore, a public health expert and scientist in our midst today. I would also like to call upon the ushers to kindly approach the dais and extend this felicitation to Shri Kaushik Sharma, the Senior Vice President of the HDFC Bank. Thank you. A very good morning to all in attendance of the program. We are gathered here this morning to witness the launch of the 10-bed ICU project and the TeleICU hub, and also the inauguration of the 10-bed ICU ward alongside the TeleICU hub. This elite project is the outcome of convergence and concerted efforts between the government of Meghalaya and the noted and renowned private organizations, which include the Karuna Trust, Infosys, 10BedICU.org, the Vinod Khosla Family Foundation, HDFC Bank, and the eGov. Foundation. A brief background to the project for the benefit of the House. The project, which includes the above-mentioned facilities, is to be implemented in every district of the state and is expected to make remarkable changes in terms of primary and tertiary care in the rural sectors in the health area. The project helps and aims to equip the hospitals and healthcare facilities, regardless of the geographical challenges the state faces, with state-of-the-art life-saving equipments for ICU support. The innovative TeleICU units will be connected to the district hospitals, which will be manned by a centralized TeleICU hub. And this is a groundbreaking achievement for the state and is expected to elevate the public health facilities and save more precious lives without solely depending only on the capital city. Through the concept of local participation that has been woven into the fabric of this entire project, accountability, high quality, and equitable service delivery will definitely be ensured. On that optimistic note, may I now call upon Shri Sampat Kumar, the Principal Secretary, Health and Family Welfare Department, Government of Meghalaya, to kindly deliver the welcome address.
Good morning to all of you. I'd like to pay my respects and greetings to our Honorable Chief Minister, Shri Konrad Sangmaji, and also our Honorable Minister Health, Madam Amperin Lingdo. And also I would like to extend warmest greetings and welcome to Shri Nandan Nilekani, who is the founder and also the person who actually brought the Aadhaar to the country. So I would like to extend a warm welcome to you, sir. And I also want to extend a warm welcome to Dr. Vinod Khosla ji, who is again another greatest American Indian entrepreneur who has been credited for so much enterprise and so much in fact technological innovations from Silicon Valley. And I also wanted to thank Mr. Nachiket Moore and also Dr. Sudarshan, and most importantly our respected Chief Secretary, Shri D.P. Valangsa, who has been here and who has been guiding all of us, and Dr. Joram Beda, and all other dignitaries who are present here who have been supporting this initiative, including the Bisoya from the 10BedICU project, and also the participants, especially I can see our senior health officials and doctors and nurses who are present here. Today is a very important occasion, because it's actually a meeting of two, basically we are people from California, Dr. Vinod Khosla, and from southern India, from Bangalore, and also from Northeast. We are all actually getting connected. It's a meeting of a great, vision and great minds. As all of you, I think this is something that I just want to say as a introductory remarks for this initiative. As all of you know, the Meghalaya is a very unique state. It's a beautiful state, but it has a lot of geographical challenges. And the state government is trying to really address the geographical challenges by leveraging the technology, and also by mobilizing this entire workforce, the government workforce. So the state is actually following a state capability approach by mobilizing both supply side and also the demand side interventions. As part of that, the state is also actually working on a life cycle based approach, how actually we can really extend the healthy lifespan of the people of the state for another 10 to 15 years. So that means, so to do that, the state is actually coming up with a lot of innovative ideas, and how actually we can really improve the health outcomes. As part of those initiatives, in fact, under the guidance of our Honorable Chief Minister, we could able to see a 40% significant reduction in the maternal deaths in the last 3 years. So this is again by strengthening the primary health care, by addressing some of those geographical challenges, by providing sensitive support to the pregnant mothers and children through the Chief Minister's Safe Motherhood Scheme. So all this is, on one side it is happening now. When they come to the hospital, how actually we can really save the mothers and children. So there we require a lot of support, like what the ICE critical care support, what is going to be provided through this initiative. Through this initiative, 14 facilities in the state are going to have these critical care facilities where actually they can be supported remotely with the specialist doctors, because we have a shortage of specialist doctors. In the absence of the shortage of specialist doctors, this intervention is going to be very, very helpful. And as I said, it's a basically there is a global leaders are there who are thinking on these ideas, and we have national leaders. In fact, our Honorable Chief Minister has a vision to take our state to the top 10 states, in the country, in the next 5 to 10 years. So in that vision, the state is working, putting a lot of effort in terms of like how actually we can leverage the technology, we can leverage these partnerships to take, to achieve this goal. So with this great idea and vision, and this program is being organized, and I thank everybody for being partnering in this initiative. Thank you very much, and Kublai Shibun and Mithila.
Thank you, sir, for the warm welcome address and adding to the depth of the program with your passion and compassion for upgraded critical care support for those in need in the rural areas. Thank you for leading the team, sir, with your vision. Let us now have a viewing of the launch video of the 10-bed ICU for a better understanding.
Meghalaya, the abodes of the cloud, nestled within its lush green mountains and crisscrossed by the Khasi, Jaintia and Garo hills, Meghalaya truly is a paradise on earth. The topography that makes Meghalaya a sight to behold also presents its own set of obstacles, posing significant challenges to patients in rural Meghalaya in accessing emergency and critical cases. Often, precious lives are lost on the way to higher order facilities.
Our state has been having a high maternal mortality rate and also the high infant mortality rate. Setting up of these ICUs will greatly help to reduce the deaths of these infants and the mothers.
Delivery patients like written placenta or maybe PPH or the stroke patients if they comes. In that case, like we have to refer to higher center.
On the 19th of July 2021, the government of Meghalaya signed an MOU with E-Government's Foundation and Karuna Trust to implement the 10-bed ICU project to improve the critical care service delivery at secondary facilities by leveraging technology. The 10-bed ICU project, conceived by Mr. Shrikant Nadhamuni, the founding CTO of Aadhaar, was a response to the COVID-19 pandemic. The project has now evolved into a system-strengthening project with 5 intervention pillars and is being implemented across 9 states. A project management unit headed by the Commissioner and Secretary Health oversee the overall implementation of the project.
10-bed ICU project is going to really help building the state capacity to really address a lot of health challenges.
To achieve outcome, all of us need to work hard collectively. The project management unit has a vital role to play. The PMU needs to monitor and review the project implementation actively, removing obstacles and ensuring all components are delivered with the highest standards.
The 5 intervention pillars are: first pillar is to provide a set of world-class equipment and help set up an ICU ward in every district hospital to create and provide ICU infrastructure to critical patients closer to their home.
Within a period of 2 weeks' time, they have given us the list of equipments which was allotted to the facilities, and the facilities were also identified where are these 10-bed ICUs to be started.
We have the beds, we have the monitors, we have the portable X-ray machine, the ECG, defibrillator. These are the equipments which are required to run a proper ICU. We are very happy that we are getting the support.
We have strengthened our district's hospitals, the MCH, to have the ICU's beds, the oxygen line, the compressed air.
If we want to save the life, we have to believe in golden hour concept. So in district hospital, having an ICU, actually it is going to save the life. That will help cut down our morbidity and mortality both.
Second pillar, TeleICU hub and spoke ICU network. To address the shortage of specialists, Meghalaya is setting up 2 TeleICU hubs. A hub has been set up in Jengjal, connecting all the ICU wards in the Garo region. A second hub is being planned to connect all the ICU wards in Khasi and Jhantia regions.
The hub and the spoke ICU network is an improvement over a standalone ICU ward in the public health infrastructure. The model can simultaneously alleviate the missing ICU beds and missing specialists. It will develop the capability of the hospitals at remote locations to handle more complex cases.
People from South Garo Hills, they don't have to travel far to run, because to run it takes nearly about 5 hours. So a lot of precious time is lost during the travel.
With the implementation of this TeleICU, cases referred from the other district will be less.
The real-time 24/7 care where we can directly interact with the medical officers providing care and even have a look at the status of the patient. For example, if you have a head injury, we can even look at the pupils to see how the pupils are reacting, and minute-to-minute real-time care. That is what the value addition of a 10-bed ICU will bring us.
We have tried our level best to give the best connectivity. With this application in place and with the better connectivity in place, so many patients can be saved.
Third pillar, training and capacity building. Training and capacity building is an important pillar for building the capability to handle complex cases. In collaboration with Hub Hospital and resource organizations, we provide rigorous training on BLS, ACLS and ATLS for the doctors and nurses of spoke hospitals.
training ni ko bang batas kian ni kon skida pera na mana ha jekai heart attack o anchumai ki handle kana nanga unbaksana bang bata changon bisarang shock ngen sem ode ba mereka angen bronchial asthma wanda ke banga sabi sirango anchumai ki critical care ko nanga.
We also provide training on medical equipment such as use of ventilator, ABG, monitor, and defibrillator. We provide rigorous training on use of care technology platform, hands-on session on TeleICU consultation, data entry, and analytics. Also, weekly refresher sessions, new updates, and user feedback sessions are organized. Fourth pillar, care technology platform. The care platform that hosts the TeleICU is a robust technology platform recognized by the United Nations as a 50th digital public good. It has several modules such as patient management module, clinical management module, provider management module, asset management module, facility management module, and inventory management module. Care is now ABDM compliant, introducing a seamless generation of on-demand Aadhaar IDs for unregistered patients in the Ayushman Bharat Digital Mission Registry.
I am happy to see that the dashboard generated from the care platform, if this dashboard captures the bed utilization, different types of cases admitted, and especially the human resource ratio, the productivity, etc., it will be very helpful for us in monitoring and making the administrative decisions.
Fifth pillar, communitization for sustainability. We will adopt the approach of communitization to ensure equitable access and long-term sustainability of the project.
We are very happy and proud that Corona Trust, as a partner to eGov Foundation, is implementing this project in the state, and which will bring lot of benefits, especially the rural population of the Meghalaya.
Especially now with MHIS, that is the Meghalaya Insurance Scheme, which is so important scheme, especially for the people of Meghalaya. You can avail all the services, and through that card, the Hospital Management Society will be able to generate the fund, and the fund subsequently you will be able to use and upgrade the ICU and for procurement of other equipments.
I would like to thank the state government, the health department, our hub and spoke hospitals, the doctors and nurses, our partners, and everyone has been together with us since the beginning and helping us initiating this project and making the vision into a reality.
Nyawi nang em cucu gejing ya rab yong kia inang yo boring yo msine bam de em de kides no komenis nyaw em biha jana is nyaw kama mami man bi man pagi yo jing ya rab ki yo jing kesani
Gapun hospital ci yang ode damrang ko rakpati nangge ni damrang ko rakpati nangge ni minat ngari ang nagda manja ya hospital lo ICU dong ode nampat.
Having seen and heard the significance that this project entails for the healthcare sector in the state, may I now request Shri Srikant Nadhamuni, the founding CTO Aadhaar and Chairman 10BedICU, who has taken the pains to join us virtually and share this visionary morning, to kindly make a virtual presentation to the House.
Good morning, everybody. My warm greetings and welcome to Shri Conrad K. Sangma, the Honorable Chief Minister of Nagaland, Dr. Mazel Ampreen Lingdo, the Honorable Minister of Health and Family Welfare, Shri Donald Phillips Balang, Chief Secretary, Government of Meghalaya, Shri Sampath Kumar, the Principal Secretary, Health and Family Welfare, Shri Joram Beda, the Commissioner and Secretary, Health, Shri Ram Kumar, Secretary, Health and Family Welfare, Shri Vinod Khosla, the founder of Khosla Ventures, joining in from California. Shri Nandan Nilekani, Chairman Infosys and Founder Chairman Aadhar. Padma Shri Dr. Sudarshan, Founder Karuna Trust. Dr. Nachiket Moore, Public Health Expert and Visiting Scientist from the Banyan Academic Institute of Leadership. Shri Kaushik Sharma, Senior Vice President, HDFC Bank, and all the other dignitaries and friends attending live at Shillong, as well as globally through Zoom and YouTube. It is indeed a pleasure to be here for the launch of the 10BedICU project here in the state of Meghalaya. I was to be in Shillong today, along with all of you. Unfortunately, I tested COVID positive a few days ago, and I'm sort of quarantined at my home in Bangalore. I apologize for not being physically there, but very excited to share the progress we've made working with the government of Meghalaya today. I hope you can see my presentation here, and let me. So the 10BedICU project is constructed on 5 pillars, as you saw in the video. And the first pillar being the equipment that we launch in the hospitals. We not only we order them, we deliver, we install, and we train the people on the ground on the equipment. The second, of course, is the CARE award-winning technology, which is a cloud-based platform. You can see in that graphic, a little bit like Meghalaya, land of mountains and clouds, but this is a different kind of cloud. We'll talk a little bit about what this technology is, what the magic of this cloud technology that connects all your hospitals across the state. Third, of course, the TeleICU hub, in order to handle the acute shortage of specialists. We'll show a little bit more about that. The training that we conduct, comprehensive, not just medical, but also other aspects. And lastly, of course, the community participation that we bring in to get the local community involved. So basically, on the medical equipment side, about 26 pieces of equipment, high quality equipment are shipped to each of your hospitals. Hybrid ventilators imported from Hamilton, Switzerland. These are AI ventilators which are able to auto-wean the patient based on CO2 levels and the tidal volumes on your chest. So even if you don't have sophisticated specialists on the ground, they are able to take care of the patient and auto-wean the patients. So this comes from Hamilton. The blood analysis comes from Siemens, 5 paramonitors, ECG machines, X-rays, Fowler beds, syringe pumps, infusion pumps. All of this is very high quality equipment that is deployed with a 3-year warranty. The CARE platform that we talked about, this is something that we have spent about 2 to 3 years building, but today it is a very robust electronic medical record that is able to handle everything from patient administration to health information, treatment plans, lab information, facility management of wards, provider management of doctors and nurses, asset management of all the assets that have been deployed. This is a full-fledged system on open source that is available to the government of Meghalaya, and it's running on the cloud. And it has been, Google has donated 1 year of free access to the state of Meghalaya. The CARE platform also comes with a state dashboard. Many of our chief ministers in several states have this dashboard on their very office. We encourage Chief Minister Sangma to also have such a dashboard for Meghalaya showing up on your office, sir, where you will be able to see the number of patients that have been admitted across the entire state, the state they are in, the breaking up on female and male boundaries and so on and so forth. All of this data, bed occupancy, the number of consultations had, all of this is available dynamically in real time. Of course, it has won an award by the United Nations as the 50th Digital Public Good. And moving quickly to the TeleICU hub, we're very happy to launch 2 TeleICU clusters in Meghalaya, one in Garo Hills and one in Shillong. The Garo Hills is live, Shillong is yet to be operational. And as you will see today, we will show you a live demo of Dr. Francis, I think at Garo Hills, connecting up to a spoke hospital, perhaps Williams Nagar or one of the hospitals, and actually treat a patient. We'll show you how this is actually done using this cloud technology, the kinds of features that we have provided, the doctor-to-doctor video communication, the high-resolution cameras that have been put on the ICU wards, the electronic medical records that are available for the medical specialists at your medical colleges and tertiary hospitals, as well as the 5-paramonitor integration, deep integration, so that at the hub, the time series data of the patient can be seen, whether it's SpO2 levels or BP and temperature and so on. So today we will see at Jengjal Subdivision Hospital at the West Garo Hills, the TeleICU hub in operation. And you will see our specialists using our equipment and connecting up with patients in spoke hospitals. Here you're seeing one of them, the Joy Civil Hospital along. There are many others. On the training aspect, we basically have training on the medical equipment, basic critical care training, advanced life support training on the clinical side, and the care software training. And we'll talk a little bit about another module of training that we are trying to bring on board. This rigorous training is truly what differentiates this project. This is not just about putting technology or creating infrastructure, but this is actually about improving the capacity of our doctors, nurses, and medical staff in order to improve patient outcomes across the state. Lastly, but not least, community participation. We are creating Rogi Kalyan Samitis in the local communities. We are partnering with the Population Foundation of India, and they are guiding us on the community processes, especially related to accountability. So these are the 5 pillars that we normally talk about at a Chief Minister's launch in each state. But today, we have very exciting news on advances that we have made in the last about 12 months. So I want to talk about 5 new advances that we have made and then wrap up. The first is we are connected to the Ayushman Bharat Digital Mission Grid. So we'll talk a little bit about what that means. Number 2, we have created standard ICU protocols to improve patient outcomes. And we'll talk a little bit about how our clinical group from all around the world, literally, all the states coming together have created these standard ICU protocols. We'll talk a little bit about that. Third, smart ICUs. Can we take existing legacy ICUs and upgrade them to the 10-bed ICU quality? So we'll talk about that. This is the smart ICU project. Number 4, we've been working on generative AI. You've all been probably using ChatGPT and so on. So we have partnered with OpenAI as well as Google, and we are trying out 2 different tools. One is the AI nurse assistant, and next the AI diagnostic co-pilot for doctors. And we'll show you, this is initial work on these 2 projects, but we will show you perhaps some demos of these. Firstly, the Ayushman Bharat Digital Mission, National Mission, Digital Public Infrastructure for Healthcare in India, and care is connected to Ayushman Bharat Digital Mission. And we are milestone 1 compliant, where ABA number creation and the people with existing ABA numbers can avail of all the facilities in our ICUs through care. It is milestone 1 compliant. Milestone 2, if you are a health information provider, one of your hospitals, you can share the record of a patient with another hospital where the patient has gone to with patient consent through ABDM integration. This is also complete, HIP integration. Then milestone 3, HIU. If you want to get information from a patient, digital records from another hospital, you can do so with patient consent. And by the way, this works across government hospitals and private hospitals that are participating in the ABDM system. And last but not least, the HCX, health claims processing. The hospitals can submit claims with the insurance companies, whether it is the Ayushman Bharat Digital Mission ABDM insurance from the center, or it is your Chief Minister's insurance cover in the state itself. This can be made to work through HCX. And I want to today announce the National Health Authority has certified care in Meghalaya for ABDM as of 2 days ago. So we are live with ABDM in Meghalaya. Secondly, standard ICU protocols. A fantastic team of doctors have come together to identify a short list of conditions for which a lot of patients come to our ICUs nationally. It could be shocks, septic shock, it could be cardiogenic shock, it could be cardiovascular events like STEMI, ST elevation with myocardial infarction or atrial fibrillation, or acute respiratory failure and so on, pulmonary conditions, or it could even be a snake bite. Okay, we see a lot of cases of snake bites, diabetic ketoacidosis, and so on. For each of these, our team of doctors is working on a standard ICU protocol. And we'll talk a little bit about it. So here is a chart of a shock protocol where whether it is a septic shock or whether it is cardiogenic shock is you'll able to identify using this. And it's very useful for nurses to have these posters on the ICU wards in order to follow some of these protocols. Even though they're trained on it, there's a lot of detail on the flow charts and the drug dosing information. And this is very, very useful for nurses and doctors. So we are providing these posters for them to use. And other very interesting thing, since we had created this content of standard ICU protocols, we looked at using AI in order to take these protocols and convert them into reference text so that the large language models like GPT, like Gemini, and so on, could actually use these to answer questions that the nurse asked in their own language. You can ask the question in whether it is in Hindi or Tamil or and so on, different languages. You can ask the question in your native language and get an answer accurately back, right? So this is an attempt that we are making with OpenAI and Google, but it's in early stages. This is an assistant tool. This doesn't replace doctors and nurses, but it helps them. So this is under test. Doctors from across the country are working on it. Dr. Padmashree Srinivasa is our head of clinical who sits in California, and she is guiding this entire team. And we have Dr. Shiri and Dr. Atul in our project itself who are part of this project. Dr. Rakesh, he's at Janims in Imphal. Dr. Akre is at Kohima. Dr. Madhusudan from Mysore in Karnataka. Dr. Shishir Jadhav is from the KCDH, Koita Center of Digital Health, IIT Bombay, and Moita has been helping publish these documents. So thanks to this entire team that put together these. And the next part is the Smart ICU project. We are trying to see if we can take existing legacy ICUs that you have and upgrade them to all the facilities that we are talking about. This is again a very important project where we can convert your existing older ICUs. Of course, there is work that we need to do. We have to connect to your devices and so on, which might be non-standard, but this is a very exciting project we are taking up. So with this, these are the innovations we're taking up. Before I hand over, I want to say, the Meghalaya 10BedICU donors, I want to thank Vinod Khosla, who's just joined us, I guess, from California. I see him on the screen. He is, in fact, funded about 10 of the 14 hospitals we're going live with today. I want to thank HDFC Bank Parivartan, Shashi Jagadishan, the CEO of HDFC, and Kaiza Barucha, the CSR head, have all been very, very instrumental in making this happen. And we thank Google Cloud for giving us a free access for 1 year to the state of Meghalaya. We thank Hamilton Medical for donating 1 ventilator for every 2 we buy. So these are our donors today in the state of Meghalaya. Of course, our team has some fantastic, highly dedicated people. I want to call out Pisoya Leutenbaum, who is the national coordinator for rolling out our project across the country. She's done a fantastic job. You all met her. We have Dr. Padmashree Srinivasa, I mentioned, head of clinical. We have Sujata on the financial side. On the technology team, largely based out of Kerala, we have Aparna Satyanathan, Jijin Chandy, and Bodhi Thomas spearheading the effort. They are incredible folks. Chandraban is heading the Northeast coordination, and our entire team, all those wonderful ladies you see up there on the first row, they're all state coordinators. They run our project in every state. Dr. Aneri, Iba is in Meghalaya, Sarita is in Sikkim, Kajal is in Manipur, Ashramita is in Pondicherry, and so on. So we have a fantastic team. I want to thank them for their fantastic efforts. Of course, this is completely philanthropic. Every piece, whether it's the medical equipment, whether it's the software, whether it's the training, all of this is not-profit work. E-Governments Foundation that I started with Nandan Nilekani 20 years ago is spearheading this effort along with Karuna Trust. Dr. Sudarshan is there representing Karuna Trust today. The donors, of course, Vinod Khosla, HDFC Bank Parivartan. Other projects have been funded by Crypto Relief, Give India, and so on. The partners, as I said, Hamilton Medical and Google have donated their products. KCDH and IIT is working with the Population Foundation of India, and People First is giving us fantastic software engineers. With that, I just want to say we are today in 206 hospitals, 10-bed ICUs in 9 states, over 2,000 beds being managed in 9 states. And today we go live in Meghalaya. With that, I want to thank you, Chief Minister, for giving us the opportunity, and we look forward to working with you. Thank you.
A very big thank you to Mr. Nadhamuni for the informative presentation we have just seen and heard, and showing the path towards taking the healthcare facilities of Meghalaya on board technological advancements such as this, yet still being able to give this high-end technology local relevance. We wish you speedy recovery too, sir. Dr. Nachiket Moore, a renowned public health expert and scientist, will now share further on the probable potential and scope of the 10-bed ICU project for the benefit of the House. You have the floor, sir.
Shri Conrad Sagma, the Honorable Chief Minister of Nagaland, Dr. Amparin Lingo, the Honorable Health Minister, Shri Walang, Chief Secretary, Shri Sampath Kumar, Shri Joram Beda, Shri Ram Kumar, the donors that were mentioned earlier, Mr. Khosla, Mr. Nilkeni, Padma Shri Dr. Sudarshan, and Mr. Sarma of HDFC Bank. I'm really pleased to be here at this very important launch in the Northeast. Chief Minister, sir, your state is a beautiful, beautiful state. I had the opportunity to visit here earlier many years ago, and most recently for this particular inauguration. And I'm very inspired to hear about your vision that in the next 10 years you want to take the state to be one of the leaders in the country, showing us where we can go. And this 10-bed ICU project is just one example of the many things that you're doing to make progress. And I'm very grateful to have the opportunity to be here with you all. One of the things I want to point out is that while in many aspects the state has to progress in order to achieve its potential, healthcare is a very, very key component that reaches out to the last mile to every single individual and helps transform the potential of the state. Because it has links with financial protection. If people are sick, they're not able to work. There is a very high level of impoverishment associated with healthcare. So I'm glad to see that there is a real effort to improve the healthcare situation in your state. One of the issues, sir, that people sometimes when they think about healthcare don't fully appreciate is the importance of secondary care, of hospital care. Primary care is extremely important. I'm not going to tell you it's not. And I know your state is doing many experiments to get the primary care infrastructure going. But the reality is that, and some of the work that I've been involved in other states shows that beyond a point, primary care improvements are not going to give you the maternal mortality and infant mortality targets you want. If you have maternal mortality of 2,000 or 3,000, which countries like South Sudan have, primary care is extremely important. And I'm not saying even at lower levels it's not. But when you have maternal mortality of 100, 150, 200, without blood, without C-section, without the ability to provide advanced critical care, you're not going to be getting the numbers down. And what is the target, sir? If one wants to think about targets, maternal mortality numbers, global best, are 5, 4, not 100. Infant mortality numbers are 2, 3, not 30, 40, or 50. Right? This is very achievable for a state like Meghalaya. The 10-bed ICU project, sir, has a very powerful potential of giving you a platform on the basis of which you can build this. We all hope, sir, that we will get specialists in every district hospital and we'll get MBBS doctors in every primary care setup. This, unfortunately, sir, is going to take time, because it's going to require a level of development that may not be possible for us in the next few years. Maybe over time this will happen. The good thing is technologies like the 10-bed ICU project are able to now connect seamlessly and give you referral back and forth in a way that was not possible even 5 years ago. Today, with optic fiber networks across the state, which is something that I want to emphasize again, that every state needs to prioritize so that down to the last village, down to every district, you have high bandwidth optic fiber. With optic fiber, so you can run a NICU in a district hospital. You do not need to transport patients to your capitals. Specialist supplies are, instead of spreading it out across the country, across the state, concentrating it in your hubs, making sure they're available as needed. Today we are talking about ICU. There are other places where we are talking about providing inpatient mental health care, for example. Nothing that is impossible to do. Cancer care, you can bring, today sir, cancer care, chemotherapy can be done in primary care settings. Diagnosis and surgery can happen in secondary care settings with the help of cancer specialists sitting in headquarters. This platform that has been built that you sir, have brought into the state can be the transformation that you seek. I would certainly urge you to fully explore the potential of this platform while you're continuing to do many other things. And the remarkable thing, sir, is some of the pioneers of technology in the world and in India, Mr. Vinod Khosla, Shri Nandan Nilekani, Dr. Shrikant Nadamuni, these are the pioneers, sir. And these are the people that are investing in your state. These are the people that are connected to your state. It's a remarkable opportunity, sir. I would say to convert into taking your state absolutely to the top of the potential of what is possible to do with technology and with this project. Once again, sir, I would like to congratulate you and the entire 10BedICU team on this fantastic achievement. I'm hoping to see some of your hub hospitals to see what is going on. I've participated in every inauguration remotely. It's the first opportunity I have to be here in person. It's a remarkable opportunity, sir. Thank you so much for having me here.
Thank you, Dr. Nachiket Moore, for your inspiring talk and gracing us with your knowledge this morning. Moving on, for a fuller understanding of the effectiveness of the project and the impact it can have in the lives of the people of the state, we will now have a live streaming of a teleconsultation between Jengjal hub specialist and a spoke doctor at the William Nagar and Jowai hospitals, to be facilitated by Dr. Susie Paul Francis.
Thank you, ma'am, for the introduction. And before we walk you through the live demo, I would like to say a few words about the hub here. So, Honorable Chief Minister, Mr. Conrad Sangma, respected dignitaries, who are at the launch and also who are joining us remotely. I'm Dr. Paul Francis. I'm a senior clinician working here at the SDH Jengjal Hospital. The Jengjal SDH Hospital has also been designated, as you heard, as one of the hubs in Meghalaya. If you can see the screen behind me, this hub is currently connected to 7 spokes in Garo Hills, 5 in the Garo Hills region, 2 in Jowai, and 1 in Ganesh Das Hospital at Shillong. Soon, this will be broadened out into, as we heard earlier, 14 spokes here and 2 hubs, 1 at Jengjal and 1 at the Ganesh Das Hospital. Apart from providing support for critical care to all the spokes, this hub is also involved, as you saw in some of your videos, training also in collaboration with CMC Velo to all the doctors and nurses who will be there at the spokes, not only in basic critical care, but also in advanced critical care. But before I hand over the time to Dr. Susie for walking us through a live demo, it is our privilege once again to thank the Government of Meghalaya, the Honorable CM, and also the eGov Foundation, the 10BedICU, and also the various donors as we heard here, for setting up this whole innovation here. You know, it's very important
what we call as the golden hour, in critical care. It's very important. Any patient, we heard some of the algorithms which have been developed for critical care. It's very important that critical care, access to critical care comes as close to the communities. And this is very important, especially for us who are working in remote areas, their access to critical care. And also the connectivity, both in terms of geographical connectivity as well as to the internet connectivity, may not be very optimal. So thank you once again for everyone for setting up this innovation. And we are committed to support to take it across the state. Now I hand over the time to Dr. Susie Paul, who's a senior obstetrician and gynecologist and also in charge of the HDU here, to walk us through a live demonstration through one of the spokes in supporting critical care to a patient who is admitted in the ICU. Dr. Susie?
Good morning, respected Excellency, the Chief Minister, respected dignitaries, and my colleagues. Today I'm going to walk you through the CARE platform and show you how you can communicate with the spokes in different regions. So today I'm going to take you to William Nagar. As you can see on the screen, all the spokes are given here. Then you come to William Nagar, click on the patients, and you come to the area of how many patients are admitted. And see the respiration, the pulse rate, and the oxygen saturation. As you can see, this patient has 63 pulse rate, SpO2 of 97, and her respiratory rate of 13. You can also go to a platform where you can actually view the patient. You can see the monitor. You can also have a face view of the patient and can go up close to see how the patient is. You can also have a bed view, so that you can have a look and see that how the patient is, whether there's any complications. Then you can also have a look at the medicines that the patient is getting. As you can see, she's on IV injections. You can also have a look at her files, and you can see that there are some investigations. You can zoom in. And then you can, of course, zoom out and you can see all these things on the screen. Now we will go for a live demo with the doctor at the spoke in William Nagar. We're going to connect to her by WhatsApp. Good morning, Dr. Salmachi. How are you?
I'm well, ma'am. How are you?
I'm fine, thank you. I just had a look at the patient that you referred to us. Vital seems to be okay this morning. Is there any other problem that you're having with the patient?
Ma'am, actually, her BP has been fluctuating, ma'am, since last night. Now also her BP is 180 by 120.
Okay. Is she on labetalol?
Yes, ma'am. She's on injectable labetalol.
So I think you can continue the injection labetalol whenever the BP goes up. And if she's stable otherwise, then just leave her alone. I also saw in the investigations that she has some elevated renal function tests and liver function tests. Maybe you can repeat that again and see that, whether it's coming down or anything else needs to be done. I hope the urine output is okay.
Yes, ma'am. Since 21 hours, it has been 800 ml, so it is adequate now.
Okay, so I think we need to keep an eye on the urine also so that she doesn't deteriorate. Okay, thank you, Dr. Salmachi. Also, I'll be connected by WhatsApp also. There's an app on the connected to my mobile, so I'll be available all the time. So in case you have any problems, you are free to contact me anytime. Thank you.
Thank you, ma'am.
Okay.
Thank you, ma'am.
To you.
That was a heartening conversation we just witnessed, and I do hope it inspires trust in the effectiveness of this much-awaited project. Considering that there are many facets to these groundbreaking innovations, may I now invite the director, 10BedICU, Bisoya Loitongbam, to present a demo video on the Care AI Nurse Assistant, Care AI Transcription Engine, and Smart ICU being the latest technological tools in the healthcare sector.
Apart from the care feature which we have, Srikant have just presented, care is an evolving technology based on various inputs, feedback from the spoke hospital. We try to improve and enhance our technology platform. Many of the features, as Srikant has mentioned, is about the smart ICU. Then there is the AI transcription engine. Why we have come up with the AI transcription engine is many of our doctors and nurses are already overloaded, so they don't have time to write the prescription or do the patient health data entry. So we have come up with a transcription engine. We have Ayushma, so we'll present a very short demo of all the new technology we have, which are done, and some are work in progress. Chandravan, can we have the demo video, please?
The 10BedICU team has been working to upgrade care with ABDM framework and AI-based technology to simplify the workload for healthcare professionals and enhance patient experiences in ICUs. New patients can register in care using Aabha ID, the unique health identifier from Ayushman Bharat Digital Mission, with on-demand generation for unregistered patient. Linking Aabha number to health records also allow the patients to share their previous medical records with the doctor, ensuring continuum of care. MediSpeak allows nurses to speak to the system and get the data transcribed into the relevant fields in the electronic medical records within the care software.
42/104 mm of SG, heart rate is 126 per minute, SP2 is 72 with high flow O2, temperature is 98, respiration is 26.
The feature is also available in their local languages. Our smart ICU capability enables the high-resolution camera in the ICU to look at the 5 paramonitors, capture the reading displayed on the screen, and automatically saves it to the patient's digital records in care. This detailed timeline of vitals will ensure enhanced critical care in line with the best practices set by the medical fraternity. The AI-powered Ayushma tool guides the nurses through the correct medical protocols to be followed at any point during the patient's stay in the ICU, especially when the patient requires urgent and critical medical interventions.
What are the parameters to monitor the effectiveness of resuscitation?
The Ayushma tool will guide them on precautions, next steps, and drug dosage to ensure the clinical processes in the ICU adhere to the latest standard practices established in the field of medicine and recommended by bodies like ICMR. When the patient recovers and is discharged, care linked with ABDM ensures he has access to his complete digital record created at the hospital on his smartphone. This enables the patients to have complete control over the medical data. These records may be shared by the patient with any subsequent hospital he visits through ABDM, ensuring continuum of care.
Thank you, Ms. Bisoya, for the captivating demo and the enlightening information. There is palpable expectations in this house, I'm sure, to see these features work excellently in favor of all our people in need. We are indeed privileged to have been part of this groundbreaking event for the state of Meghalaya in terms of the health sector through this innovative intervention. And in light of this knowledge, may I have the honor of inviting the Honorable Chief Minister Meghalaya, Shri Conrad K. Sangma, to kindly launch the ICU wards and the TeleICU hub on a virtual mode. And I would like to request the House to please join in with a round of applause. Thank you so much, sir. We also have Mr. Vinod Khosla, the founder partner of Khosla Venture, joining us from across the globe this morning, and it would be my pleasure to invite you to share a few words with the gathering. This will be followed by an interaction with the Honorable Chief Minister, which will be facilitated by Dr. Nachiket Moore. And we continue to see the participation from all the various hospitals across the state. Can we now join Mr. Vinod Khosla, the founder partner of Khosla Venture, joining us virtually?
Thank you. I'm delighted to join the 10-bed 10BedICU project launch in Meghalaya. I want to congratulate the Chief Minister, Mr. Sangma, the whole Meghalaya team, and the 10BedICU team on this occasion. It's always exciting to see these launches. Our family has funded these 10BedICUs in various states in the Northeast. And given the healthcare challenges posed in this region, I'm really happy to see this launch today. Across all 14 districts and hospitals, I'm told that two TeleICU hubs are also being created to help with the shortage of specialists. Especially since Meghalaya is such a mountainous region and access to critical care is remote and so challenging, it's exciting to see the role technology can play and the TeleICU approach specifically. My hope is it will become a role model for much of the care, and we will have remote specialty centers catering to every remote region. I'm also excited to congratulate the TeleICU team and Srikant himself on all the exciting innovations we've seen coming out of that group. Integration of the 10BedICU platform into the national digital healthcare grid, creating standard ICU protocols to improve the quality of critical care, the Smart ICU project, which will hopefully also help upgrade legacy ICU wards to 10BedICU standards, and all the generative AI tools. Having been involved in generative AI for the last 5 years, I can tell you, and having seen hundreds of projects, what I see here is among the most exciting of those, like MediSpeak, which is allowing people to speak in their natural language, diagnostic co-pilots for doctors, nurse assistants, and I would encourage the Chief Minister and the whole team in Meghalaya to take advantage of all these innovations, especially given the resource constrained settings. I, for one, am personally convinced that the quality of this care will be higher than through traditional medical means, not just equal or just sufficient. So again, I'm very happy to have funded these units and looking forward to the improved critical care outcomes across the state. So thank you again, Mr. Chief Minister Sangma, for your active leadership. You know, technology is wonderful, but it doesn't happen till you get the right leadership. And it's very transformational to see that happen. Thank you very much.
Thank you, Mr. Khosla. This is Nachiket here for the interactive session with the Chief Minister. You know, one of the things that we heard was the Chief Minister's aspiration to take the state to the highest possible level in terms of development and growth. One of the, I don't know, sir, if you had any questions for Mr. Khosla on the role that technology can play, the role that, you know, Mr. Khosla was the founder of Sun Microsystems, has led many of the technological developments around the world.
Thank you very much. And on behalf of the state, I would like to thank Mr. Khosla and all the donors for this great initiative and the great contribution that they have made to healthcare in the state of Meghalaya. We have seen that there has been a huge transformation in terms of medical care, from manpower improvement to medicine improvement to machine improvement. And now we have the information technology aspect now coming into healthcare, which would be the next
next revolution that we are seeing in terms of predictability, different models, and how information technology will play. Where do you see this whole aspect of information technology, data, and predictability aspect playing an important role for the country as a whole, and being able to see how technology will really be able to bring all of this together? Of course, we are all doing all of that, but I would like to just hear your thoughts on this, on how we see things moving forward.
Yes. So it's very nice to hear that question, because I love talking about what role technology can play. India has been fairly advanced in putting together the Aadhaar infrastructure and the payment systems and all that. And I think that infrastructure will be a huge advantage in delivering all kinds of services. So I'm one of those optimistic people who believes within the next 5 years, and maybe shorter than that, we will be able to make most expertise, especially in medicine, almost free. I believe every citizen in Meghalaya, in all of India, will have a huge free personal doctor that will be an AI doctor supervised by a human doctor. So the human doctor won't have to do everything, just supervise the advice these AI systems are rendering. And then everybody instantly, no matter how remote they are, will be able to get help in primary care, in chronic care, if you're looking after chronic diseases like diabetes, get personalized coaching for the diet they like, the family circumstances they live in. I'm very, very optimistic that service will be near free and probably cost a lot less than primary care costs even in India today. The same will be true of other specialty services like mental health care, which in the COVID era has become very, very important, but also whether it's needing other specialists like oncologists, God forbid anybody gets cancer, or endocrinologists because you have diabetes, those services will be near free. And I think AI technology will make that possible within the next few years. So it's a large opportunity for somebody to pioneer its first application when the rest of the world is skeptical. I think the same will be true in other domains that are important. I believe for near free, every student will be able to have a personal tutor teaching in their native language, understanding what the student understands, finding the gaps in their learning, and tutoring to those gaps. So a number of these specialty services that today depend on expensive experts or rare skills that are not scalable will become available through technology. So I'm quite optimistic about that.
Thank you, Mr. Khosla. I just have one last question to you. You and your family has really been contributing to the change in the healthcare in so many states, and what you have done today is going to touch many, many millions, lakhs of lives in states like ours. My question to you is a personal one. What has motivated you to do this and to work with states like ours, to work in the healthcare and to make such contributions that will save lives?
Well, I grew up in a very ordinary household in India. My dad joined the Indian Army in the ranks, and then over his career got promoted to a major. So we had a decent life, but not a rich life, I would say. And I today feel I have almost everything I could possibly want for myself. It's very rewarding and frankly very enjoyable to impact the lives of others and be able to do that with something I have a real passion for, which is technology. So it is very rewarding and in some ways almost selfish to say you make yourself happy by helping others.
Thank you so much once again, Mr. Khosla, and I can assure you and tell you that whatever contributions you are making is going to make a huge difference in the people's lives out here in our state of Meghalaya, and of course in the whole of Northeast and the whole country. So thank you so much.
Thank you. It's a privilege to be in a position to do that.
Heartfelt gratitude to you, Mr. Khosla, sir, for having been such an integral part of this path-breaking transformation in the healthcare facilities in our state of Meghalaya, despite the distance and barriers. And thank you to the Honorable Chief Minister, sir, and Dr. Nachiket Moore for challenging the faculties of the audience inside this hall, all across the state and globally through the various platforms with your deliberations. In this star-studded gathering, we also have the Chairman, Infosys, and Founder CEO Aadhaar, Shri Nandan Nilekani, and it is my honor to invite you, sir, to kindly share your thoughts this morning, which will also be followed by a short interaction with our Honorable Chief Minister.
Thank you, and I'm delighted to be here at the launch of the 10-bed ICU project in Meghalaya, in the presence of the Honorable Conrad Sangma, the Chief Minister, the Department of Family and Health, and the 10-bed ICU team. I'm also delighted that Vinod is on the call. Vinod has been a huge supporter of this project, and it's really wonderful to be here. This has been a very important approach. The 10-bed ICU has developed a very standardized, digital-first approach to providing services in intensive healthcare in remote parts of India, and also leveraging the hub and spoke model with the TeleICU capability. And this is really the model which I think makes sense, especially in a terrain like Meghalaya. We in India have, over the last decade or so, built what we now call as digital public infrastructure, which is population scale infrastructure, which transforms society. We have things like Aadhaar, with 1.3 billion people with Aadhaar IDs used 80 million times a day. We have world's largest DBT program where money goes electronically in real time into people's bank accounts using Aadhaar and bank accounts and all that. We have UPI, which enables, it does more than 11 billion transactions a month, 350 million users, 50 million merchants with QR codes, and so on. And there are many more to come. So this approach of digital public infrastructure has actually laid the foundation for the transformation in India. And the 10-bed ICU project is very much part of this thinking, which Srikanth has brought about. Srikanth and I co-founded e-Governments Foundation 20 years back, and I'm delighted that e-Governments Foundation is executing on this. And Srikanth has also worked with me as the head of technology at Aadhaar when we built this massive platform for over 1 billion people. Now, the exciting thing, as Vinod mentioned, is the arrival of generative AI. And we believe that DPI approach actually enables us to quickly roll out AI on top of the DPI infrastructure we have. And we think that every aspect of our DPI will get amplified with AI. So we don't think it's just DPI plus AI. We think it's DPI to the power of AI. And to the point Vinod mentioned, we are looking at amplifying human capability. We will always have a shortage of doctors, nurses, specialists, and so on. And if we can amplify the ones we have so that they can reach more people with better diagnosis, better care, then we'll be able to deliver much better healthcare at a fraction of the cost that it is in elsewhere. So I think DPI to the power of AI is the way to go. And that's something that we are going to do very soon. So once again, I want to congratulate Chief Minister Sangma and his colleagues for this path-breaking initiative. And I really would look forward to seeing Meghalaya as a state that is the prime mover and pioneer in implementing DPI plus AI to the power of AI to really transforming the lives of everyone in the state. So all the best and have a great launch. Thank you.
Good morning, Mr. Nilikani. And thank you so much for those very kind words and more importantly, the very encouraging words. I would just like to ask you two questions. First is, of course, that we all know that technology is a very disruptive kind of force. And it obviously makes a lot of positive changes in terms of the kind of service that we can give to people using technology and make things better. But while it does that, we do have challenges because it changes the kind of job opportunities that are there in the market. And hence, how do you see the impact of technology in terms of job creation? And what could be the possible areas where you feel that states and governments should look at to focus on creating jobs, more jobs, and being prepared with the kind of technology that's coming in our generation and the future generations from now on?
Thank you, Honorable Chief Minister. And I believe that overall AI will be a net positive. Yes, there will be some jobs lost to AI. For example, as coding and building software becomes more automated, then obviously you can do more with less people. But actually the big opportunity of the next 20 years is the AI transformation of the world, where every business and every government will have to be reimagined to be AI first. And that is actually a much bigger opportunity than what is lost because of automation and so on. And I think we in India, with our young, vibrant workforce, our investment in learning, our investment in DPI to the power of AI, can actually become the AI base for the world as the whole world starts to migrate itself. And we see that there'll be very rapid innovation in AI. There'll be new models, new ways of doing things, faster, cheaper ways of doing things. But if we focus on how do we use this technology to make a difference to people, like we are doing in the 10BedICU project, I think that will be really something great. So I'm confident that while there will be some areas where AI will reduce jobs, overall it's a net positive, particularly for India, which already, I don't know if you've seen the figures, but India is at, $250 billion in software export, expected to reach $300 billion in the next couple of years. Indian expatriates working abroad are this year sending back $125 billion, the largest of any country. So India's human talent is powering the world's IT and services revolution, and that will only continue in the world of AI.
Thank you so much, Mr. Nilikani. I had to have just one more question. I remember in college in 1995 to 1999, I was doing my undergrad in UPenn. And I remember studying about Infosys and studying about you. So that's how long I've been following the things that you have been doing. And you have recently also taken the Aadhaar movement and founded the Aadhaar movement. And today the country is number one in terms of different transactions, digital transactions, as you mentioned. So a lot of things have been done through you and through your organizations. My question to you is again a personal one this time, is where do you get this motivation and where do you get this entire thought process of how to move forward, these different ideas, and what motivates you to move forward in these different game-changing aspects and works that you do for the country?
Well, Chief Minister, I'm really excited by the transformation capability of technology. As you rightly said, I had a very successful career at Infosys for 30 years, and then I got an offer from then Prime Minister Manmohan Singh to join the cabinet and lead the Aadhaar project, which I took up. It was a very daunting task. We had to deal with lots of adversity and all that, but we managed to get it done. And I realized that while the rest of the world is using technology to sell you advertisements and all that, the real use of technology in a society like India is how do we improve the lives of people, how to create an open access society, how to get people from the informal to the formal economy, give them an ID, give them a bank account, give them a mobile connection, get them jobs, give them access to credit, get access to markets. And if you do that at population scale, then India will be a very different country. So that's what keeps me going, even though, I'm doing this for a long time, and you're rightly saying, why are you still doing it? But I think I get up every day excited by the future.
But I would like to correct you. I didn't say why you're still doing it. In fact, we are happy that you're still doing it, and we hope that you continue to do it. So thank you so much, Mr. Lenegni, for all your support, your guidance, and all your contribution and work that you've been doing for our nation. Thank you so much.
Thank you, sir.
Thank you, sir, for having kindly graced this event with us, albeit virtually, and sharing your views on AI interventions. It is truly inspiring to be part of such moments in progressive governance and see how technology can positively impact societies in its actuality. And to the Honorable Chief Minister, too, sir, for having been part of the discussion with such thoughtfulness. It is indeed a proud moment for our state. We also have the respected Chief Secretary Meghalaya, Shri D.P. Walang, sir, this morning, and I would like to have the honor of inviting you, sir, to share your thoughts on this occasion.
Thank you, Twinkle. Honorable Chief Minister of Meghalaya, Shri Conrad K. Sangma, who's the chief guest in today's inauguration. The Honorable Minister for Health and Family Welfare, Kong Amprin Lingdo, Shri Nandan Nilekani, the former chairman of UDAI and now the chairman of Infosys, Shri Vinod Khosla from Khosla Ventures, Shri Shrikant Nadhamuni, the former CTO of UDAI and now chairman of this 10-bed ICU project, Dr. Sudarshan Hanup Mappa of Karuna Trust, Mr. Nachiket Moore, public health expert and scientist, and Mr. Kaushik Sharma, the senior vice president of HDFC Bank, the officers from the state government of Meghalaya led by Principal Secretary Shri Sampat Kumar, Commission Secretary Joram Beda, the directors who are here, the joint directors and other officers, all the medical professionals, all the members of various NGOs who are present here this morning, and members of the press, both from the print and electronic media. A very good morning to all of you, and a very happy occasion to be here this morning on this very important and really a landmark day for all of us in the health sector. I'll make it very short because quite a number of speakers have spoken and are going to participate. I've been traveling a lot in the past 2 months, in fact, and most of these travels are to the interior areas. One gentleman who's sitting on the dais very quietly without saying a word actually is responsible for setting up about 9, if I'm not mistaken, PHCs in the rural areas. They are all in the back of beyond of Meghalaya. Very, very difficult areas. In fact, I went to Saipung, I got stuck over there, and somehow I managed to reach the public health center over there, and it's Karuna Trust, led by Dr. Sudarshan. It was a fully functional public health center, and I was very, very elated to interact with the doctors over there. It's challenging, the whole area is so difficult to reach, and they did a very, very remarkable job. Same is the case with Aradonga, which I went about maybe a month and a half back. They were there also in full force. Not even a single vacancy was there at a point of time. What I'm trying to say is that it is proven that the public-private partnership has worked very effectively in the state. And today, this occasion also marks one more step of public-private partnership in which critical care units will be set up in 14 hospitals all over the state. But being a bureaucrat, we always tend to look with a microscope. And to err on the side of caution, I request the health department to kindly look at a few issues. This is a huge, humongous step, and it is just the first step. It's not that the ICUs have been set up and it's done. In fact, challenges will come from now on. We have seen it just 4 or 5 days back. I was in Bakmara District Hospital, and we have seen the challenges over there. We need for an ICU trained doctors. We need for the ICU trained nurses, which is very, very important. And the third pillar, which is equally important but mostly forgotten, we need trained ICU technicians. And it's very, very difficult to get trained ICU technicians because if any instrument breaks down, a lab technician will not do it. You need specialist technicians. So I request the health department to kindly have a look at all these aspects and ensure that a standard protocol is made to ensure that within a flick of a button, everything is solved and all the personnel are placed at the right places. Second is that let the units that are formed meet the IPHS standards and also ensure that, for example, nurses, you'll be needing one nurse for 2 patients. That's a huge number cutting across the whole state. That is the standard. And when it comes to infrastructure, also it's going to be quite challenging because you'll need a fully AC ICU. In a place like Bakbara, in a place like, William Nagar and all that, it may be a bit difficult. But I'm sure that if you are prepared for it, so the whole point I'm trying to make is that you have to be prepared from now on. It's not that it's inaugurated, it's done, it'll start functioning automatically. No. A lot of training has to take place, a lot of capacity building has to take place, and a lot of follow-up. Somebody was talking about just now that leadership is important. Yes, we can see the leadership at the top. The Honorable Chief Minister is here, the Health Minister is here, the commitment is there. But the leadership has to percolate down to the local level. Wherever the hospital is there, wherever the CHC is there, the leadership of the local doctor is most imperative. So I request from the director's side, the health department side, to send this message across that it's important that local leadership is also there. You will have problems. Infrastructure is a big problem, and you'll have problems of power. But of course, now that power has really improved in the state in the last 4 or 5 months, we have not had any major issues. But there has to be redundancy because an ICU will not work without power. You have to have solar connectivity. Ensure that you have to have generating sets fully functional in remote areas. It's very, very important. Connectivity is not a problem. We are having a TeleICU hub now. And in this hub and spoke model, if you don't have connectivity, it's going to be very sad. But the good news is that, as Honorable CM was saying, the statewide area network is going to be developed. And in fact, when we were in Ranikor about 2 weeks back, we saw the Reliance Geo network was fully implemented over there in very, very remote areas where even vehicles are difficult to go. But again, it depends on the local leadership. If a bank which was functioning over there doesn't get proper connectivity in spite of the fact that OFC is running in front of it, it's sad because nobody's doing anything about it. So it's important that local leadership take it up. The last point I would like to make is, you may say that, okay, setting up ICUs and all that. What about the nurses? What about the doctors? We're so short of nurses, so short of doctors. I'm happy to say that since under the leadership of our CM, the recruitment board has been formed, and I'm sure in the month of February, by next month, additional nurses, additional doctors, additional medical personnel, paramedical staff will be again recruited through this board, and I'm sure then everything will be put in place and all the sanction posts will be filled. This will be the first time, in fact, in the history of the state that there'll be sanction posts less, the vacancy will be less than 2% of the vacancies after that exercise is completed. And that is what is required, and that is what needs to be done. I'm happy that the government is focusing a lot on the social sector, education. We've seen, we went and saw it in Garo Hills last week. All the teachers in the elementary sections, the interview process has been completed, and with the teachers in all the schools, no vacancies again, it will be a game-changing situation in the state. In health, we have seen the recruitment that has been going on, will again continue in the month of January, as I said. It'll be a huge game changer again. And last, in drinking water, this is also one sector that has a lot of focus in the present government. We started in 2018 with 4,600 connections. That is functional household tap connections, 4,600. the lowest in the country. Today, we stand at 470,000 functional household tap connections, and increase of 10,000%. Hold your breath. I'm saying 10,000% increment over a period of 5 years, which is really phenomenal. And I must say that all credit should go to the state leadership again in this. And we will continue to work hard as officers, and I'm sure that by next year, we will saturate this. It is important to connect all the three, that is education, drinking water, and health, because they complement each other. And I'm sure if we do our job well, things will improve in the state, and the main beneficiaries will be the common man. Thank you. Bitela Kublai Jai Hind.
Thank you, sir, for the encouragement and lending such depth to the event and the venture. Your words bear testament on the probabilities of the astounding success of this venture, and surely the suggestions that you have shared are very readily welcomed by the department and the partners. Let us now lend our ears to the other leader heading this department, the Honorable Health Minister of Meghalaya, Dr. M. Ampareen Lyngdoh, who I would like to humbly request, ma'am, if you would grace the audience with your speech.
Okay, everybody's using this. Very, very good morning to one and all. Honorable Chief Minister of the Government of Meghalaya, Shri Conrad K. Sangma sir, the IAS Chief Secretary, Mr. Donald Walang, our Principal Secretary Health, our Secretary Health, all the dignitaries on the dais and off the dais. It was such a pleasure to be able to have a virtual interaction with Mr. Shrikant Nadhamuni. Very interesting to speak to Dr. Nachiket, to hear Dr. Nachiket Moore speak. It was such a pleasure to also be able to connect with Jengjal and the team in Jengjal, headed by Dr. Susie Paul Francis. It was again so interesting to see what Bishoya had to share with us about Care AI. We're very, very happy that Mr. Khosla, the founder partner of Khosla Venture, also was able to connect with us this morning. Very, very happy to hear what Mr. Nilakini, the founder of CEO Aadhaar, had to say. And of course, we have all the other dignitaries on and off the dais. I can see all the doctors here from across pretty much every part of the bureaucracy of the health department, headed by the DHS, MI, and everybody else. Today is indeed a very happy day for all of us. First and foremost, as the Honorable Health Minister of the Government of Meghalaya, I, on behalf of all of us in the Cabinet, welcome the implementation of this project in every district. We know that we are geographically challenged, and we have all been through all kinds of journeys in our efforts to improve the health infrastructure at whatever level that we could possibly do. Today takes us to another level, and that is what excites me as a person being given this opportunity by the Honorable Chief Minister to lead this important venture forward. I'm also so happy and delighted to know that the audience today is predominantly nurses, medical staff at various capacities. This is where the state of Meghalaya has now come. Now the point is, are we as a team, going to be able to provide adequate health care to every citizen in the state of Meghalaya. I have seen some of the ICUs across the state, and I must say, against all odds and challenges, we must give it to the medical staff that works so hard, day and night, keeping up a vigilant watch over welfare of citizens across the state of Meghalaya. The state of Meghalaya has a very big strength, and that is our nursing fraternity. So much of lives are saved because our nurses rise to the occasion and save lives in real time, real situations, in the most challenging of locations. At this point of time, it is but natural for me to once again call upon our nursing staff, our doctors, to work together in a project which involves the community. Community involvement is a mantra in the state of Meghalaya. We are indebted to all related to this community work that we have begun in the state of Meghalaya. In a very important indicator such as the mother mortality rate, communities have proven beyond imagination that they can support government in saving lives of mother during childbirth. We are indeed very, very happy to see that now that we have a very strong base, we can get into bigger things with the involvement of technology. I would believe that when you implement technology in healthcare, you are truly able to bring treatments closer to the people. The hub and spoke that has been discussed by every expert who has spoken before me goes on to lend valuable insight, and that is we can save lives every time we utilize technology in our efforts. The state today has serious issues with cancer treatment, serious issues with kidney failure treatment, serious issues with NCDs, or the non-communicable disease treatments. And this is where technology can be utilized very valuably to save the lives of individuals. There has been this discussion about artificial intelligence, and very often as laypersons, this term brings fear to our minds. But today, we have seen that this technology will enable us and strengthen us as a community, especially in areas such as healthcare. There will be a need to have a collaborative review of policy if we have to ensure that we track patients from wherever they are, whichever institution that they have been treated, and connect them when there is a critical situation. I know that this is possible because just very recently, the leader of Maukarwat Civil Hospital is here. They were able to perform a big surgery in as remote a place as Maukarwat. Nothing is impossible. It is just the mind, it is the approach, and at this opportunity given to us by the bureaucracy who have understood all the gaps in health infrastructure, I appeal to doctors, nurses, paramedics, rise to the occasion, join hands, and fear not. Correct, we have to ensure that SOPs are maintained. We cannot be found lacking in the maintenance of our SOPs because lives of individuals are very, very valuable in this entire chain of cloud-based technology. For me, it has been a very fruitful morning, and I am happy that I was woken up to attend to a program such as this, to understand how best can we reach out to every citizen, giving them a sense of security that if you should fall ill, no matter where you are, we are going to attend and we are going to do whatever it takes to save your life. Thank you, Honorable Chief Minister, for your insight and your knowledge and this exposure that you have given all of us. I am sure that we will all go back home this morning feeling that sense of security that yes, we can continue to save lives. We will continue to save lives closer to the homes of the sick. With these few observations, I congratulate Mr. Sampath Kumar and the team. Thank you so much, Sir Sampath, for all your valuable suggestions, interventions. Now you have given us this beautiful plate. It is yet to be seen, as the Honorable Chief Secretary has said, that are we ready to partake of this new experience from a brand new plate amidst all our challenges. I am sure that we are going to get around this. We're going to figure a way out to empower all the infrastructures located all the way down to sub-centers. We will try our best to ensure that we power them, give them drinking water, which sometimes are such ridiculous reasons for the non-functioning of our infrastructures wherever I have been. I look forward to going ahead and learning more about this program and BedICU launch at Shillong in respective district centers. And I look forward that all these hubs and all these spokes will do one good thing for the people of the state of Meghalaya. Give us good health, deliver, speak less, work more. Thank you so much. Kublai, Mithila, Jai Hind.
Thank you, Madam, for your ever positive and zealous support to the initiatives of the department and sharing your stand with the gathering. We look forward to continue being a part of the team as we scale newer heights in the facet of better healthcare sector and through up-to-date and public-friendly policies walk astride the other complementing sectors of the government, as had also been pointed out by the respected Chief Secretary earlier on today. It is not just our good fortune, but an exceptional privilege that the department has been able to get the assistance and partnerships of some of the most respected names and institutions for the betterment of the healthcare facilities in the state of Meghalaya. And therefore, in due recognition of their concern and cooperation for the success of this project, we would like to hand over a certificate of appreciation to the Senior Vice President of the HDFC Bank, Shri Kaushik Sharma. May I request the Honorable Chief Minister, Shri Conrad K. Sangma, to kindly hand over the certificate to the HDFC Bank. And also, as much awaited by all, sir, may I humbly request you to address the House thereafter. Sir, if you like the other podiums also.
That's okay. It's fine. Thank you. My colleague in the cabinet, Dr. Amperine Lingdo, our Honorable Minister for Health and Family Welfare, our respected Chief Secretary, Shri D.P. Watlang, all our other officials of the health department who are present here on the dais and off the dais, Mr. Khosla, the founder partner of Khosla Venture, Mr. Nilekani, the chairman of Infosys and the founder CEO of Aadhaar, Dr. Nachiket Moore, the public health expert who's present with us on the dais here, Mr. Shrikant, the founding CTO of Aadhaar and the chairman of the 10-bed ICU, our senior vice president of HDFC, Mr. Kaushik, and all the other friends and dignitaries who have joined us here physically, as well as those who are present online, all the doctors, the medical officials, and the nurses, and all my dear friends who are here to be part of this very, very important and a very, very positive and I should say a satisfying moment where we will see a huge change and difference in the way healthcare is being provided at the grassroots level to the people of our state. So I take this opportunity to first of all welcome all of you, and more importantly, thank all of the stakeholders who have played a very important role in making this 10-bed ICU project a success. And we have started and we have launched with some of the locations today, and I'm sure that we will be able to complete the other locations very soon. And more importantly, we look forward to ensuring that they are run with optimum utility, and also aspire to ensure that we are able to expand this even further so that we can reach the other nooks and corners of the state and different regions which are inaccessible. Having said that, this is again another step forward in the direction which we had set ourselves to move in about 5.5 years back, when we had taken over in 2018, and the first MDA government. I had clearly mentioned to the cabinet and to all the officials that we will give top priority to our social sectors, and health will be one of the major areas in that aspiration of ours. And I'm happy to inform you that in a matter of 5.5 years, India, in Meghalaya today, has become the #1 state in terms of the percentage that we spend on health in terms of our budget. Meghalaya is the highest. Over 8% of our budget is spent on health care, which, as I said, is the highest in the country today. So this speaks volumes about the kind of dedication and the commitment and the kind of focus that we have towards health, and to ensure that health services are transformed at every single step. And having said that, I have been a very, very firm believer in ensuring that we have to make sure that we utilize our assets and our manpower that is there and the resources that we have in the most efficient and positive manner. And we have realized that while we have a large number of things to be done, while we have many more hospitals and centers to be opened, while we need to ensure that more machines are there, while we need to ensure that more manpower is taken and technology is implemented, we often forget that there is already a lot of things in our hand which we do have. And we sometimes fail to make what we already have productive. And hence, we started off by ensuring that whatever there was already, how do we make things better? How do we ensure that the sub-centers, the PHCs, CHCs, the manpower that we have, How can we make it better and perform better in it? And through the process, I'm happy to see that these kind of very low-hanging fruits, as we call them, small tweaking being done in the system, we were able to really see a drastic improvement in the overall health sector in the state. And one of the numbers that I would like to share with you today is regarding the MMR. And just to give you an idea, that the average in India, the national average was 113 in 2019. This is just 1 year after we had taken over. 113 was the MMR in the country, national average, and Meghalaya was 200 plus. So we were looking at about 200, 220 numbers. So 113 was the national average, and we were 200 plus in terms of MMR. In a matter of 3 years now, at 2022, 2023, Indian national average is still 113, whereas Meghalaya has come down from 220 plus today at 120. And we are very close to touching the national average and hopefully coming below it very soon. And these things have not been done because of huge investments being made on new technology or anything like that, but by ensuring that our team, our officials, our doctors, our nurses, the different kind of services at the grassroots level are provided at the right time. We are able to use simple technologies to map and to monitor our high-risk mothers and be able to intervene at the right time with the right resources and the right manpower. And just by doing simple things like these, we were able to transform and change the sector. And I hope that we will continue to do this and be able to come down below the national average in maybe a couple of years. So this will be a huge achievement, and I must say this credit goes to all of you who is in this room today. Each and every one of you has contributed to making these small differences in our people's lives, which are very, very meaningful. Now, having said that, the health sector as a whole, or the health, I should say, industry as a whole, which I was mentioning earlier when I was speaking to Mr. Khosla, is that the different transformations that have taken place. We saw in the beginning how the manpower, the training, and how medical research led to transformation and change in the overall medical sector, in the history of medical sector. Then we saw how medicine started playing a very important role. So the innovation that took place in medicines led to a transformation or a revolution in the health sector. And then the machines came in. And when the machines came in, it was like a third revolution where we saw the huge change because of important machines like MRI, CT scan, and other machines that came in that transformed the overall health sector. And now the current revolution that is taking place is actually the information technology revolution that is taking place, the AI revolution that's taking place in the health sector. And hence, health sector is going through a huge transformation as we speak today. And we saw a glimpse of what that can do. And technology is going to play a very, very vital role, especially in providing health services, and especially in regions like ours, which is very, very disconnected and difficult terrain that we have in our state. And therefore, just to give a simple idea to you, that apart from what we're doing in care, the technology that you've seen, I think some of you understand the depth of that technology, but we want to go further into that and be able to micromanage details of every patient in the state today. And we are moving towards that. And this data and this information, as you know, will allow us to capture the actual scenario that's happening at the grassroots, analyze it, and be able to create predictable models as to what we need to see happening in the days to come. And obviously, AI will play a very crucial role in being able to really implement the data that is there and create those predictable models and allow us to then be able to take policy decisions as to how we should change things and improve things to have a better impact on the overall healthcare sector for our state. So this is a very, very important stage. And what we are seeing that's happening today, in terms of the 10-bed ICU that's coming up. Some of you might just think that this is just an ICU that's coming up, but this is much more than that. There is a lot more going on beyond what meets the eye, where yes, through the telemedicine, we will give the healthcare services. But while we do that, as I said, we are creating a massive database, a massive predictability model, and AI being part of that will allow us now to transform and be able to create a better preventive medication system in the coming days. And that's what really is the most exciting part about what technology is doing in the health sector. And I'm sure that this will have a huge impact in how we do things in the future. While speaking on that, I also want to add that when technology is being implemented, just so that all our listeners and our guests who have joined us, especially Mr. Khoshla and Mr. Nilikani, would be happy to know that we have a very, very massive and a strong program for IT in our state. I am handling the IT portfolio myself because it's a very, very important portfolio. And we have just finalized our entire optical fiber network connectivity in the state, down to the block level, down to every PHC and CHC. And we will start implementing this in the next 2 to 3 months. Some already are connected, but most of them are not. And so we will be starting this entire network. And in a phase-wise manner, I expect that in about 12 to 15 months' time, 90% of all our important administrative units and all our important health units will all be on optical fiber. Some of the most distant ones will be the ones that will take time, but in most of the cases, we should be able to do it quite fast. But apart from having that, we have just finalized also our state data center, which we expect that it should be up in the next 12 months' time. So the data center is obviously the cloud that we talk about. So we will be having our own state data center very soon. We already have our ICCC program, where we have the Integrated Command and Control Center, which will be again inaugurated in the next few months. And this is where we will be having our data center. And I'm also happy to inform you that we have already started our discussion to get the submarine cable link directly from Chittagong and coming via Dauki here to our city of Shillong. So once we have that optical fiber and submarine cable connectivity, that will be again a very, very crucial part to the overall IT growth and IT sector programs and policies for the state in the long term. And also to share with you that we already have close to about 5,000-seater IT park, which we have come out with, which is almost 100% occupied. In fact, we have a huge demand for more places, and hence we are going for another 10,000-seater center here in our state. And you'll be happy to know that we have just finalized the IT policy, where we are creating huge incentive for companies to come and set up their base here in Shillong in the IT park. And I'm hopeful that many industry leaders who are here, like Mr. Khoshla and Mr. Nilikani, will be also very, very instrumental, and I should say can be of huge importance to the state in terms of even the growth in the IT sector. As you know, we have got huge manpower out here. In fact, a lot of Bangalore and Hyderabad centers are actually manned by people from the Northeast, and a large number of them are actually from Meghalaya. So I hope that this will also be an opportunity to appeal and to connect with the IT sector on how Meghalaya could play a major role in the future, not just in BPO, but even when it comes to areas of artificial intelligence and areas where the medical areas of technology can be implemented. And with us going for a project like this, how can IT and medical sector be combined, and Meghalaya can show the way on how jobs can be created in this sector, in both these sectors together. So it's really, as I said, it goes beyond what meets the eye today. You are looking at just the ICU. For me, I see a great future in terms of how we can lead the way to show to the rest of the country on how technology and medicine can go together and how jobs can be created. Like Mr. Nilekini was mentioning, that some jobs may go, but the future in terms of a young population, which can be very adaptive. Other populations are older, so they may not be able to adapt to the kind of change in the global scenario that's taking place. But Meghalaya and India are in the right time, in the right place, and having the right demographic profile to be able to take advantage of this particular situation. And hence, I hope that as we move along, we will see that unfold, and we really look forward to having partners to make this happen. Please remember that the government has its role to play, but government cannot do everything. Government has to create the policy, the ecosystem, and be a facilitator. At the end of the day, it is important stakeholders from the private sector, the community, the public at large, different NGOs, we all have to come together if we really want to make a difference in the lives of the people in our state and in our country. I purposely asked both Mr. Khoshla and Mr. Nilekini on what motivates them. And if you saw the connection in the answer and the reply that they gave, what motivates them is the fact that they're able to make a change and a difference in the people's lives. They're able to give back to what the community needs today. And that is what drives them. Mr. Nilekini mentioned that it is about seeing how we can use technology to transform the lives of the people, to make a change, to make things better for the people. And that's really what should motivate each and every one of us. And I end my speech by appealing to all of you that you are doctors, you are nurses, you are medical officials, that small bit of motivation in your heart and in your mind, the small desire to care a bit more for the people or for the patient who's in front of you can make all the difference in that particular patient's life. Yes, technology is important, but if you don't have the right heart, then all the technology doesn't matter. It starts with you, it starts with your heart, it starts with your care for the patients, and the system, the money, the medication, the machine, the technology is there to help and support that desire inside you to able to help the people and serve the people of our state. So with these few words, I once again congratulate all the stakeholders. I really wish you all the best. And as was mentioned by our Chief Secretary, that this is only the beginning. It's not a time to celebrate, though it is a time to celebrate, but it is not really a celebration. The celebration will be every time you're able to save a life. The celebration will be every time you're able to help a patient. That is the true celebration that you should look forward to. And I'm sure that with the teamwork and the effort of each and every one, we will be able to take this project to its logical conclusion, and we'll be able to get the desired results that we are all here to achieve. With these few words, I wish you all the very best, and once again thank Mr. Vinod Khoshla, Google, the Hamilton, the eGov, the Karuna Trust, HDFC, and all the other donors who have made this project a possibility. I wish each and every one of you the very best, and may God bless each and every one of you, and may God bless our state of Meghalaya and our nation, India. Khublai Shibun, Matela, and Jai Hind.
The state has seen much progress in the health sector in the recent past through the concerted efforts of the department under the able guidance and leadership of our Honorable Chief Minister, Shri Conrad K. Sangma, who in his openness to ideas and progressive mindset has made many impactful changes in governance, and this morning is yet another attestation to the fact. Thank you, sir, for your time, valuable viewpoints, and wholehearted participation in leading the department towards the transformation curve and the vision of overall improved health sector in the state of Meghalaya. We would like to join in wishing your visionary ventures that you've just so passionately shared with the people great success in the coming days. Thank you for your inspirational speech once again, sir. Having witnessed a historical moment for the health sector in the state of Meghalaya, we now come to the end of the program, and may I invite Ms. Bisoya Loitongbam, Director, 10BedICU Project and Northeast Program Coordinator, IGA Foundation, to kindly tender the vote of thanks.
Honorable Chief Minister, sir, Health Minister, madam, and other dignitaries on the stage, friends from the Meghalaya health community, the 10BedICU team, and friends from the media. Thank you for your overwhelming support for the 10BedICU project, without which this day would not have been possible. When we look around, we find a few initiatives are lucky to be able to transform themselves into development platforms of technology and people. Fewer initiatives are fortunate to create communities of change makers from across domains. As we inaugurate the 10BedICU project in Meghalaya, the initiative is blessed to emerge as a development community, a platform facilitating technology and social interactions, and a movement for transforming public health infrastructure all at once. The purpose of our movement is health equity, more specifically, access to critical care services for all. Our movement started by questioning the silent acceptance of disparity in access to critical care amidst the numbing COVID-19 pandemic. We were driven by a common belief that a person, irrespective of their social category, gender, age, or location, should have a similar chance of receiving life-saving services. We believe that a person in Karnataka or in Meghalaya, in Khasi, Garo, or Jaintia Hills, living in Shillong or smaller district hospital should have similar access to critical care services. The emergence of the project as a development platform could not have been possible without the coming together of change makers from across the domains and their unselfish contribution, and most importantly, the unstinted support of the state government. We are immensely grateful to the health officials who have joined us across states. I want to sincerely thank Sampath sir for his unwavering support, always being very prompt with his responses over the WhatsApp and giving time whenever sought for, and also for making the launch a reality. I thank Joram Beda sir for motivating the team, for enthusing the much needed energy, and for his clinical insights and constructive feedback to improve the upcoming AI module. I thank Mr. Ramkumar sir for taking up the project and support throughout. I did also like to thank Directorate of Health Services and our PMU member, especially Dr. L.M. Umlong, Joint Director MI, for giving direction, leading the implementation, and guiding the project team. We remain grateful to Dr. Hunsigiri, Dr. Keshav, who put in much effort, Meg, Krishan, and all other members, DMHOs of all districts. We have received unquestioning support from our patrons who are leading philanthropists like Mr. Khosla, HDFC Bank Parivartan, Nusrat and team. Seamless collaboration from our NGO partner, Karuna Trust, Goswami, Mrityunjay, Reni, Rishad, technology collaborators like Hamilton Medicals, IIT Mumbai, Koita Center for Digital Health, Pupil First Kerala, OpenAI, Google. A big shout out to Siddharth Pai and Citiz. Thanks to our health sector partner, Manipal, Vellore Hospital, Nimhans, Janims, Care Hospital, GMCH, SMCH, all our hub and spoke hospital, Dr. Rakesh of Janims, Dr. Pradeep Rangapal, Manipal Group, Dr. Arakre, Dr. Madhusudan, have been selflessly contributing to the clinical part and giving direction to the project. All of you inspire us. Thank you, Dr. Paul Francis and his team from Jengjal for championing the TeleICU hub and spoke model, leading the hub at Jengjal. Thank you very much. I would like to thank our doctors as spokes, Dr. Kruji Sangma of William Nagar, Dr. New Star, and Dr. Cherry of Ganex Das, Dr. Arlanki Hing and of Jowai, Dr. Ilijar, Dr. Nehru Marag, Dr. Nitish Agarwal, Dr. Seema Marag, Dr. Calvarine, all medical superintendents, nursing superintendent, and the nursing staff. Thank you, Hazel and Ador, manager of the State Convention Center, your amazing support for all the support in organizing the event. Thank you, DIPR and press and media. I want to thank the amazing team from the e-Government Foundation, Chandravan Kakoti Notice Program Implementation Head, who has been tirelessly working with his team on the ground, Iba, Lamare, State Coordinator, Meghalaya, putting all the effort to hold the various project component, Salgra Sangma Hub Coordinator, Jengjal, who has been silently deploying, activating all the spokes and entire implementation, of team of Notice who have all come together, the implementation team from South, Dibjyoti, Ashramita, Kajal, James, Sei, Sunil, Gayan, Mrityunjaynath from Karuna Trust, who has been a part of the implementation team. Thanks to our technology team, Sanjay, Jijin, Aparna, Bodhi, Khavin, Neil, clinical team, Dr. Padmashri, Dr. Atul, and a big shout out to Sujata, Amruta, Manjunath, Shahid, and Vinay for promptly supporting us. Last and very important, Srikant, for bringing us all together and starting this movement, most importantly, for being the person you are. I believe the initiative is well on the way to develop as the people's movement for public health infrastructure, in which our doctors and health workers from the spoke and hub hospital are at the forefront. Some of the early signs of this potential are already there. When Manipur was burning in the initial days, the doctors and nurses from different ethnic groups at war with each other were collaborating seamlessly to save lives. In the hospital at Churchandpur and other affected districts, the project also took humanitarian action beyond the project scope to supply medicines to hospitals whose regular channels were disrupted due to the conflict. In Assam, the Honorable Chief Minister has included the 10BedICU project in his dashboard and personally monitors the project. The Karnataka Health Minister takes a review of our team quarterly. We are also witnessing the voluntary coming together of doctors and experts from technology and health domains to include our improve our applications such as AI, teleradiology, that would further strengthen. Today, standing in Shillong, which has been a seat of regional collaboration and the vision the Honorable Chief Minister just shared, I aspire that this initiative could break ground initiatives such as setting up a regional grid for Northeast where various hospitals, there are referrals, seamless referrals, knowledge sharing, collaboration among various public hospitals in the region. This would further add to the effectiveness of the project and make the dream of high quality, affordable critical care available to many. With this, I would once again thank the Honorable Chief Minister, Mr. Conrad Sangma, for gracing the occasion and sharing your vision with us for the region. We promise to put our best effort into translating his vision into practice. Thank you very much. Thank you.
We have come to the end of the program this morning, and I would like to request the entire House to kindly rise and join our Honorable Chief Minister for a photograph, commemorative photograph. This is to announce that all the nursing students and the other students are requested to kindly remain seated in your place. There will be people who will come to serve you, while the rest of the dignitaries and the VIPs are requested to proceed to the dining hall.